This is FX Medicine. I'm Andrew Whitfield Cook, and we're here at the 2019 NHAA 100 Years Anniversary Conference. We're speaking with David Casteleijn. How are you going, David?
Very well, thank you, Andrew.
David, you'll be giving a talk later on PEP, PRES and TasP.
Yeah.
Did I get that right?
Not quite, but
okay, that's why we need to learn this.
Not surprising, yes.
Take us through what you'll be speaking about, because it's got to do with an ever-present, do I say the word spectre now? It's like, I don't want to be a worry wart, but it is a serious condition.
It is. So all of those are related to HIV treatment.
Yeah.
Different HIV treatments. So PEP is post-exposure prophylaxis. That's been around since 1996. Where if someone had a risky exposure, they would be able to take a short course, and that would significantly reduce their risk of seroconversion. But PrEP is interesting in that it's actually pre-exposure prophylaxis. So that's somewhere that someone can take a one-a-day blue pill, and that's very effective at preventing someone from acquiring HIV. Actually 99%. So the level is remarkably high.
Still an immunoglobulin? What's the blue pill?
The blue pill is one of the antiretrovirals that have been used for a long period of time as part of combination antiretroviral therapy.
Right, so again,
it's one of.
That's a reverse transcriptase.
No, it isn't.
Again, no.
That's right.
This is how much learning I have to do.
Absolutely. So there's about 11 different categories of antiretrovirals.
Yep.
And it's one of those, and they all have very long, complicated names, and I don't remember them. But the interesting thing about it, I think that's worth actually noting at this point, is that it's one of the categories that has no interactions with our herbal medicine. So often we think of HIV medication as, oh my God, you can't have St John's wort with that. Would obviously be an interesting herb to use in someone who has HIV. It does have no interaction with St John's wort, which is fantastic.
Right.
And it's something that I really want people to know. So if their client does come to them who's on PrEP, they don't need to be worried about not giving them St John's wort and worried about interactions. It's actually very low interaction, which is great. So that's really moving along at a huge rate. So in, I think, 2015, 2016, we started trials throughout Australia, and by 2018 it went on the PBS. So it's looking, that's how positive it's looking.
Yeah.
So we're moving that ahead very quickly. The other acronym is TasP, and that stands for Treatment as Prevention. So the other side of this is that it's become very clear that someone who's treated well for their HIV and they have an undetectable viral load, they are not infectious.
Yeah.
So we can make HIV non-infectious, so that person doesn't transmit HIV, and we can also help people not acquire HIV. So this is looking like in not too distant future we should be able to essentially stop new cases, which is looking pretty amazing.
Yeah, I think they've had a second case of total remission. Is that right? Just recently?
Look, actually, Andrew, that's not an area that I've been looking at the moment. I was very focused on what are we actually doing at this point, but certainly maintaining an undetectable viral load is what we're aiming for. And we're looking at that. They want to have 90% of the population know their HIV status, 90% of those people on treatment, and 90% of the people on treatment having an undetectable viral load. That's what we're aiming for, and that's the aim in order to basically stop the transmissions.
Yeah.
It's looking really good.
So we've come a long way from the Grim Reaper era of my nursing days.
Yes.
Thankfully. I have to say, I wonder if there was a lot of paranoia in there with regard, or judgment, to the gay population, because me included, back then, I was quite fearful of that. Very successful ad campaign, but it didn't really help understanding.
No.
To me, it helps segregate communities. We've come a long way. So what things do we need to be aware of in the clinic today with regards to gay population risk, indeed heterosexual transmission risk, and how do we approach that with our patients with regards to testing, and then obviously what you're talking about with treatment?
Sure. Quite a few questions that you've asked.
I'll keep going.
Yeah. As far, actually, I think the interesting thing as far as you were saying that heterosexual community risk, the interesting bit there that's quite interesting is that they're potentially more at risk because they're they're much less interested in the whole concept. There's a whole lot less testing. So the gay male population has been very proactive in getting on board with testing and early testing. And so what we tend to see there is people in the gay male population will be have very early diagnosis.
Right.
So their diagnosis is almost immediately with seroconversion, whereas in the heterosexual community, it still can be up to 10 years before people are diagnosed. And so that's a significant risk for that population because that person's interacting in that population and not knowing they're positive, and so potentially a significant source of infection. So that's been, it's an interesting dichotomy there. The other thing that I think is quite interesting just on that is that with this treatment as prevention that I was talking about, that's not just useful for the whole population, it's actually useful for the person as well, because what's become clear is that within the first 6 months of someone actually have seroconverting, so they are positive, but not necessarily knowing, but in that time, significant leakiness in their bowel happens. Right. Due to the virus, due to the loss of CD4 in the immune tissue of the gut, and early treatment can halt that. Certainly can't reverse it, but it does seem to be able to significantly slow that down. Right. So I think that's actually a really important takeaway for naturopaths is to be on board with testing, but also being on board with early treatment. Right. Because that, I think, is a really important area where we can help preserve someone's gut integrity by actually having them on treatment, which sort of almost seems counterintuitive because it's like, oh my God, it's a pharmaceutical, delay that as long as possible. That's really not the best option for your client. The best option for them is to start treatment early, and the best option for everyone is for them to start treatment early. So that's probably one of the most important takeaways, I think, is to help people stay on their medication, encourage them to be on their medication, rather than the sort of like, oh my God, it's a pharmaceutical, therefore it's bad concept, which sometimes you do see a little bit in naturopathy.
Yeah, too much, I think. So with regards to naturopathic treatment, if we're talking about treating early and trying to maintain the integrity of the bowel and gut tissue, do we employ local things like fibres and those things that we know, probiotics, for instance, prebiotics that can help in returning bowel integrity at the local level, or do you employ things like systemic herbs and nutrients which help to nourish them?
Look, I think you're absolutely spot on with that, with your direction there, and that is maintaining the integrity of the gut. Absolutely spot on, because the issue we've had before is that it's very easy to go, oh, HIV, immune, boost the immune, and it's really not anymore. That's being looked after by the medication. We don't need to worry about that anymore. We need to look after the whole person, and naturopathy is all about maintaining gut integrity. So it's essentially what we would normally do: get their diet going really well, so it has it's mainly plants, therefore lots of fibre, lots of nutrients. So all of those things that we would normally do for anyone to help them have a full, healthy life are exactly the same things you would do. You don't really need to have, anything specific you would do differently. And I think that's actually the focus of this, is not to worry about the treatments, they're just in the background. It's just then look at the person, where do they need to go? But all of those things, either directly and locally, like your fibres, your prebiotics, which are just so important, and also your systemic. I mean, as in your herbs, they acting locally and systemically. So,
and indeed, your research is on whole treatments and the way that we can unfortunately fall into pigeonholing what we say we're not doing. And I was talking with you earlier about Ruth Tricky enlightening me and
that's
that
right, reminding me
that we very often fall into exactly what we say we're not doing, and that is treating the symptoms. So when we're talking about whole body treatment, you're talking about gut integrity, and one would think fibres, prebiotics, probiotics.
Yes.
But indeed, we've got things that affect the integrity of the gut lining, like, for instance, stress.
Exactly.
And a lot of your experience is done on one of your favourite herbs.
Oh, absolutely.
Passiflora. I wanted to go. I was going to find a way.
You can only call that a segue, though, really. My research is on whole of practice treatment of anxiety and depression with herbal medicine. And, of course, a part of that, and a particular interest of mine, is using passion flower.
Tell me how to get on with it.
So you did. Just being careful that my research is about the whole
body
practice.
Yes. I'm just talking about your experience.
That's right. So my experience of using passion flower is actually really something that I would like to do a project on at some point, but you can't do them all at once. But that's just some really interesting observations using passion flower on its own in what I would call a PRN basis. And you being a nurse, you'd understand titration, and so that's the whole principle that I'm using of finding the dose the person needs.
Yep.
So, say for instance, someone would come to me, with very significant anxiety, particularly, and maybe a history of panic disorder or PTSD. That's quite obvious quite early in the consultation. So if I thought, look, I think we might use some passion flower in this person's case, I'd go and get some passion flower, make a bit of an assessment of, okay, how much would I use? I was starting at 10 ml doses, and I can tell you about that if you have time. But now I go for 5. So I try a 5 ml dose of passion flower, give it to the person with a drink of water, because they probably haven't had hers before, and passion flower on its own, bit of a shock. And then watch them for the next 10 minutes. It works so quickly.
This is the thing that's important. We're talking about an acute phase.
Absolutely. So I watch them, and within the next 10 minutes you see the person just unfold. It's quite remarkable. I check in about 10 minutes, because you see it happen, and work out whether we maybe need another 5 ml or whatever, or another 5 ml after that. And then just at that point, while they're with me, working out what their dose is, and then we'll go from there and go, okay, so I'll get you to take 5, 10 ml whenever you need it. Whenever you feel that anxiety rise, whenever you feel something's triggered you, you have a dose. I use the little 10 ml glass bottles so that people have got a dose in their pocket. They don't have to measure it out of their desk and look like a freak show. And it's just, it just works really, really well. But
And then do you find that patients are more receptive to other measures to manage their anxiety once they're calm?
Absolutely.
Get out of
Absolutely. I think that's actually a really interesting benefit, is that within that first half hour of being with you, they've got this immediate sense that, oh my God, you're going to be able to help, right? That medicine helped. So clearly, whatever's going to be in the mixture, that's going to taste probably worse than passion flower, because the mixtures are worse.
Yep.
So that's obviously going to work, because I get a mixture as well.
Yeah.
Because you always need to treat that background. There'll be adaptogens there, obviously, nerve ions, etc. Something for the tummy, most likely. So that'll be their whole mixture that they'll take on a regular, maybe 3 times a day basis. But they'll have the passion flower that they can take absolutely as they need. And it's quite remarkable, yes.
Well, I think what's remarkable is the way that you're bringing back this whole body stuff. I say stuff, what a flippant comment. This whole body paradigm, treatment. And it really is remembering what we should be doing as practitioners, whatever our modality.
That's right.
That if you just want to give a bottle of something, you're really treating a symptom. You're really being a little doctor. And that naturopathic medicine, herbal medicine is not that.
So all-encompassing.
And it's very important research. And indeed, I've got to thank you. 2 years ago, I had a little bit of a trouble about, but what about population medicine? And I had to get over that little hump myself and realise that was the importance of what our profession should be all about. So thank you so much for taking us through. I do want to do a little quick call out.
Okay.
And that is that your important work on your talk.
Yeah.
You've actually done an updated chapter.
Oh yes, that's right. In the Clinical Naturopathy Evidence-Based Guide to Practice, the Saracen Mortal text.
Yep.
So the 3rd edition, which will be coming out very shortly. Yes. So this my talk today on PEP, PrEP and TasP is essentially from that update work. Because that was really like, wow, okay, we've moved so far, certainly in the last 20 years, but in the last 10 years, the movement has been so remarkable that I really wanted people to understand, hey, we're in a totally different place.
I want to thank you so much from a personal level, but also, for your care and your drive to bring this really important work and open it up to every herbalist, every naturopath that we have in Australia and indeed overseas. So it's just really important work. So thank you so much for doing that.
Well, thank you, Andrew, for giving me this opportunity.
Our pleasure.
I appreciate it. Thank you.
This is FX Medicine. I'm Andrew Whitfield Cook.